diabetes, which is very less discussed. People with diabetes are excelling in every field now thanks to the modern technology, and again now travel is no contraindication. Structured pre-traveling planning and patient education can definitely help in overcoming the challenges the diabetes patients face while traveling. So why this matters? Travel has become now an integral part of our life, whether for business, pleasure, pilgrimage or sports. And with the increasing prevalence of diabetes, more number of people with diabetes are traveling. And primary care physicians have very little knowledge of caring for the needs of travelers with diabetes, and proper preparation can prevent the catastrophes and substantially reduce the burden and stigma. So, what are the challenges traveler with the diabetes face? With the travel, there is a change in the diet, activity, and sleeping pattern, which might impact the blood glucose levels. Also, the climatic variations will impact the blood sugar levels and impacts the glucose monitoring accuracy, and also may render the insulin non-viable. Diabetes itself is travel itself is a stressful thing and may result in increased counter-regulatory hormones and poor blood glycemic control. Traveling to remote areas might limit the healthcare access, and also to different regions may hinder the communication and impede clear medical explanations. So the modern diabetes technology like use of CGMs, smart insulin pens, insulin pumps has transformed travel possibilities for people with diabetes. The benefits include patients are able to now maintain blood glucose, more blood glucose in time with fewer episodes of hypoglycemia and greater flexibility in diet and lifestyle. Now the devices have come which will show the low glucose monitor and warn the patients, and the patients can take appropriate steps. But nothing comes for free. So there are challenges with the technology, that the extra care is required for the devices, the availability of supplies at the destination. The devices are expensive and the patient has to wear these devices all the time, and then the challenges associated with the screening at the securities. So the pre-travel evaluation, ideally it should be done at least 3 months before the travel to allow time for immunization and also for the adjustment of the insulins and other medication. A thorough medical assessment with comprehensive history and physical examinations to look laboratory investigation, and also look for micro and macrovascular complications, and to see whether the patient is fit to travel or not, and if not fit, appropriate measures to be taken so that the patient is fit to travel in time. Preparation required immunizations, optimized glucose control, blood glucose levels and lipid control, identifying contraindications for travel and correcting them, and medication and insulin dose adjustment. Educating the patient about the lifestyle changes like diet at the destination, carb counting and calories depending on the local diet available at the destination, glucose monitoring during travel, exercise options at destination, safer disposal of supplies, and recognition of complications early to prevent more damages. So knowledge of regional differences in the medications and equipment is crucial to prevent dosage errors and complications. Like insulin is available as 100 IU per ml in most of the countries, but in few destinations it is available as 40 IU per ml. So dosing errors and panic will occur using the incorrect insulin syringe and combination. But however, the pens are available as 100 IU standard uniformly. So essential documents: physician letter containing medical ID, diagnosis, supplies and security recommendations, prescription, multiple copies, and also one prescription in the local language to the patient where the patient is traveling, medical ID regarding the medical alert and diagnosis of the patient, and resource list of the pharmacies, hospitals, or emergency services at the destination. So this is a full travel checklist which can be kept in your clinics and shared with the patients. Climate change, again, the effect of climate change, warm weather and cold weathers. Warm weather has a physiological increasing risk of dehydration, resulting in higher blood glucose. And also this higher blood glucose will cause diuresis and further precipitate dehydration. There's a vicious cycle. Reduced ability to dissipate heat through skin. faster insulin absorption rates because of the vasodilatation, and higher risk of heat-related illness in diabetic patients. So medication and device concerns, insulin denatures in high temperatures above 30 degrees. CGM sensors may dislodge due to perspiration, and also glucose meters may be affected by extreme heat. Now frioviolets and other devices cooling devices are available to carry insulin at safer temperatures around 18 to 20 degrees centigrade up to 45 hours by using water gel technology. Cold weathers, again HbA tends to increase in cold weather, reason not known. Decreased physical activity because insulin increased resistance and higher glucagon secretion. Practical concern, insulin absorbs poorly due to vasoconstriction. The finger sticks readings may underestimate glucose levels. Increased risk of frostbite with neuropathy, and devices can be damaged in again extremely cold. So people with diabetes and comorbidities like neuropathy and peripheral vascular disease must take extra precautions to protect hands and feet from cold injuries. Again, challenges at high altitude. Hypoglycemia confusion might be confused with high altitude sickness. Equipment malfunction can lead to false results. High UV radiation exposure can causes again ill health in diabetic patient. Low humidity increases the risk of dehydration and poor glycemic control. Low oxygen affects glucose metabolism, again risk of poor glycemic control. So at high altitude, if the patient is slow trekking, it increases a higher catecholamine release, resulting in higher blood glucose levels and more insulin requirement. If the patient ascends rapidly, the insulin levels requirement is less. Again, at high altitude, there is increased insulin resistance leading to poor glycemic control and higher insulin requirement, and anorexia complications like altitude-induced anorexia can complicate glycemic management. When traveling by foot, again monitor glucose before the start of the journey. Test glucose at regular intervals, maybe every 4 to 6 hourly. Carry healthy snacks. Ensure cardiovascular health, and warm up and cool down pre and post traveling. Foot care essentials: keep feet free from the callus, bunions, and ulcers. Carry an extra pair of shoes. Foot inspection that will be done regularly. Wear proper shoes so that the weight is distributed equally. Wear absorbent socks and avoid walking barefoot. While driving by road, driving with diabetes requires balancing the right to drive with safety consideration. Diabetes contributes to 18% of road accidents caused by medical conditions like hypoglycemia, being a significant risk factor. Modern technologies like CGM that can provide early warnings and can be having dashboard displays can be used to prevent hypoglycemia. Driving guidelines: follow all the local driving laws and rules. Check your glucose levels before driving, before starting the drive, and every 4 hours if you're going on a long drive. Keep your blood glucose level within the recommendations range. Take frequent breaks to stretch your legs and take rest. Bring extra diabetic supplies with you on your trip. Store insulin in cool bags rather than glove compartment, and travel with someone who understands the diabetes management. While traveling by rail, again carry extra supplies. Many trains lack special meals for diabetes, and it is advisable to carry your own meals and snacks for meal delays. Limited access to pharmacies at stations. Consider air-conditioned coaches in summer and inform train manager beforehand if possible. While traveling with sea, again, because of the lack of pharmacies and mostly luxurious food available at the cruises, so be careful with your calorie counting and carry adequate supply of your medication. Take advantages of exercising opportunities. Take precautions against common shipboard illness, particularly seasickness and infection, which is more common in diabetic patients. Traveling with air requires special condition because of air pressure changes, security check concerns, and also changing in the travel zones. So the key challenges are increased risk of dehydration, stress factors affecting glucose levels, dietary changes and meal timing, schedule delays, cabin pressure changes, and time zone changes affecting medication timing. And always carry medication in hand luggage rather than in cargo because of the extreme temperature changes in the cargo. So regarding the devices, most of the devices are not safe to be get damaged by the X-rays and body scanners. And this device's Dexcom can be used in flight, but in airplane mode. Freestyle Libre can be placed, but it should not be used in the air flight because of the hazards of interference with the communication. Eversense 3 is an implantable device. It can be used in flight. Omnipod, again, if Bluetooth is permitted, it can be used. Medtronic pump has to be switched off. And T-Slim X2 is a insulin pumping device, which will help in preventing hyper and hypoglycemia during takeoff and landing, which happens mostly with the insulin pump because of the pressure changes. And always have a physician letter explaining the need for these devices and request hand inspection when necessary, and pat down screening is safe for all devices. So managing time zones. So crossing multiple time zones, particularly more than 5 time zones, where the duration of changes is more than 5 to 6 hours, and patient taking multiple basal bolus doses are again having the increased risk of hyperglycemia. So when you travel eastward for the shorter day is shortened by the time difference. Risk of insulin stacking and hypoglycemia is high. Typically requires reduction in the total basal dose. May need to reduce long-acting insulin by 10 to 20% and monitor more frequently during the insulin adjustment period. And when you're traveling towards the west, the days are longer. The risk of insulin deficiency and hyperglycemia is there. May require additional doses of basal insulin or additional bolus dose. But again, you have to be very careful because having too short insulins in a shorter duration may again increase the risk of hypoglycemia. So practical approaches: insulin pump users adjust the insulin pump clock upon arrival. Multi-drug injection users focus on adjusting basal insulin. Consider switching to basal bolus if you are on premix insulins, and utilize online insulin dosage calculations for complex dose adjustments. So use of insulin pump in travel and flight. Flight-related hypoglycemia has been reported in diabetic individuals treated with insulin pump. Although the ambient pressure at sea level is 760, the cabin pressure decreases to 200 to 560 when the plane rises to 40,000 feet. A decrease in the ambient pressure can lead to under-release of insulin from the pump, resulting in hyperglycemia. And while coming down, again, the insulin rate increases and results in hypoglycemia. So yes, when the plane rises, ambient pressure decreases, air bubbles form in the solution. The bubbles in the pump are replaced with insulin. Increase in the insulin release may lead to development of hypoglycemia 1 to 2 hours after the departure. And when the plane begins to land, air pressure rises again. The bubble dissolves in the solution, stops the release of insulin for a while, and a decrease in the insulin release can again lead to hyperglycemia. So rules to be considered during flight in people who use insulin pumps. The cartridge should contain only 1.5 ml of insulin. The pump must be discontinued before takeoff. At the height of the flight, the cartridge must be removed from the pump and all the existing air bubbles removed before restarting. After landing, the pump must be disconnected and the line should be filled up to 2 units of insulin. Then the pump should be reconnected. In case of flight emergencies, including cabin decompression, the pump should be disconnected. So traveling in special conditions like traveling to remote areas, wilderness, again where the supplies or healthcare access is very limited, you have to be well prepared. There are guidelines by Wilderness Society guidelines. And nomads who travel in caravans, they are well prepared for all the activities except for the diabetes management. And now with the available of electronic health device and teleconsulting, these travelers can have travelers to remote locations can have access to the doctors through teleconsultations. These are the Wilderness Society guidelines for diabetes, which is again available online. So tips while traveling with insulin: carry your insulin in a cool pouch and keep it in your handbags. Carry at least twice the insulin required as per your travel days and dose. Carry non-perishable snacks like biscuits and glucose tablets to prevent and manage hypoglycemia. Carry needles, syringes, other prescribed medicines, glucometers, lancets and glucometer battery along with the insulin. Carry your prescription along with you for security checks and procedures. And do not forget diabetes identifying card and first aid kit. While traveling, store the insulin or pen in the pouch with a refrigerated cooling gel pack or Frito wallets or cool, so that the temperature is maintained at ambient room temperature. And while traveling by air, insulin should not be packed in the checked-in baggage to avoid exposure to extreme temperatures. So to summarize, pre-travel preparation is essential. Documentation saves life. Pack smart. Monitor your sugar levels frequently and always have a backup plan. Remember, traveling with diabetes requires thoughtful planning, but it opens the door to extraordinary adventures and cultural experiences. Stay informed, prepared, and positive so you can explore the world safely and confidently with proper glucose management. Safe travel and safe journeys to all. Thank you.
Thank you.